The first treatment was incredible. I didn't know what to expect.
I mean, I was running around happy, and I thought, wow, this is what normal feels like.
I don't think I've experienced anything like this.
I used to be an emergency room physician, but when I encountered this technology, I found it to be so important that I left traditional medicine, and this is all I do, and this is all I've been doing for the last 9 years. In that time, I've seen well over 1,000 patients, and I find this a remarkable technology that it treats a variety of things that are extremely common and prevalent for which there is no good treatment. Among those include anxiety, and anxiety in any of its form, whether it's panic attacks, chronic anxiety, even post-traumatic stress disorder, obsessive compulsive disorder. It's extremely prevalent, and the nervous system, right away in the first session, we usually begin to see changes, and right away we see the nervous system become less reactive. Instead of being in constant fight or flight mode, it starts to settle down into stable, what we call homeostatic mode. It's very good for depression. Mood elevates, people become social and stop isolating, they begin to enjoy life again, and again, we begin to see initial results very early. Average number of sessions for most things is about 15 to 20. It's also very effective for ADD, ADHD. Children and adults become more focused, less distracted, more organized, they work more efficiently. Actually, their friends start to like them more because they're able to pay attention to their friends instead of being so caught up in their own distractions. It's most remarkably to me, is that it's very effective for traumatic brain injury, for concussions. Starting again, remarkably, in the first session, people begin to see a reduction in symptoms with concussion, whether it's headache or nausea or blurry vision or anxiety and anger. These and more, hypersensitivity to sound and to light, these and more symptoms are associated with chronic or post-concussion syndrome. In fact, we did a study with 10 former NFL players. They averaged about 7 years in the NFL, all with post-concussive syndrome, and all 10 players improved significantly.
My name is Jesse Sapolu. Played for the San Francisco 49ers from 1983 to 1998, so about 15 years. Played offensive line, offensive guard and center. Was a Pro Bowler at both positions. Was able to be lucky enough to win 4 Super Bowls. With the data that I'm aware of now and the understanding that we have now, I did have, concussions. Back then, it's how fast you can identify 2 fingers, compared to 4 fingers. And even as far back as high school, I got stunned a couple times. I find myself getting to the point of being on the edge, of being angry, and I played this game. I love the game, but maybe I'm starting to pay the price for it now. And that worries you. But coming to this treatment has given me some of that confidence back. Some of our players are bringing their kids. So you don't do that unless you truly have a belief that it's making a difference.
Well, at least 150,000 to 200,000 people have been treated. There's probably about 800 practitioners in the world at this point. And as far as we know, there's not a single published report of someone having been worse off from having done it. So it's extremely safe. Well, in one form or another, it's been around since the early 90s. So this isn't a new technology or an experimental technology. It's been around for a long time. It's just not a well-known technology, at least not yet.
I know this is just a brief video to introduce you to Clarity Direct Neurofeedback coming to Tehachapi, but I wanted to make sure that you had a chance to see a little bit about what this powerful technology is all about. If you'd like to know more, please do give me a call. I'm Dr. Doug Cowan, and you can just give me a call right here at 661-972-5953. We are Very excited to be the only direct neurofeedback provider between Beverly Hills and up in Northern California. If this is something you would like to pursue, please do give us a call, 661-972-5953.